This year's free flu shot program has proven more popular than expected, especially among adults. But health officials warn that vaccination rates are still too low for small children. So far, only 26% of children up to 6 years old have been inoculated.
That's far below the government's goal of 55.5%. Officials say parents should not delay getting their child inoculated before flu season peaks.
This father brought his daughter to the doctor after she caught a cold. While there, he asked the doctor to give her a flu shot, but since she's ill, she couldn't get vaccinated.
I went to other clinics to ask, but it seems the vaccines have all been administered. I wanted to get her vaccinated as soon as possible. I'd feel more at ease. I'm afraid that we'll all run out.
Parents say they are concerned there won't be enough vaccines. So far this season, only 25.9% of young children have been inoculated. That's a rate much lower than adults. The reason could be that community and neighborhood vaccination centers have all given out the shots to seniors. Most health centers and hospitals offer shots only during standard business hours, forcing parents to take the day off from work to make their child's appointment. For those who don't, the only other option is to go to a clinic between 6 and 9 p.m., a window of only 3 hours. Some doctors say COVID fears are keeping parents from taking their kids to the hospital.
Bringing one's children to the hospital to get vaccinated is, after all, bringing them somewhere where there's a lot of people. So I think many parents might be hesitant and might step back from doing it. That is one of the reasons.
Last Saturday, the government suspended free flu shots to healthy adults aged 50 to 64 to ensure stocks for older seniors and young children. The premier previously said that healthy adults were more eager to get the flu jab this year after seeing Health Minister Chen Shizhong get his.
We're supposed to be promoting the vaccines to achieve herd immunity before the flu season starts.
Among the more vulnerable demographics, 37% of people 65 and older have been vaccinated. That's growth of nearly 10 percentage points from last year. In contrast, only 26% of children up to 6 have been inoculated. That's far from the goal of getting 55.5% of young children vaccinated. The government urges parents to take advantage of Sanofi Pasteur's egg-free vaccines, which are reserved for children aged 6 months to 3 years. The government says that if there's not enough demand from children, the vaccines will be made available to other groups. This year's quadrivalent shots were developed by Adamune in collaboration with 3 egg companies with 200,000 hens. More than 10 million eggs were required to produce 3.7 million vaccines for the general public and 200,000 shots for military and medical use. Deals with the egg farms were signed last year in June. Adamune says it's now too late to order more eggs for vaccine production.
They have very strict rules on how they raise the chickens. There are requirements on the chicken breeds and the quality. The eggs must come from hens between 26 and 60 weeks old.
Adamune says that this year's cohort of suitable hens aged out of the vaccine program in June. Now they are all older than 60 weeks old. Their eggs can no longer be used for development, making it that much harder to get a new vaccine supply.